Imagine being in a situation where someone's life hangs in the balance and you have the power to make a difference. Would you know what to do? This is precisely where the importance of first aid and cardiopulmonary resuscitation, commonly known as CPR, comes into play. These life-saving techniques can be the crucial difference between life and death in emergency situations. Let's take a moment to dive a little deeper into why these skills are so pivotal. First aid is the immediate assistance given to any person suffering a sudden illness or injury. It's often the first response to a medical emergency before professional medical help can arrive. It aims to preserve life, prevent the condition from worsening, and promote recovery. CPR, on the other hand, is a life-saving technique that's used when someone's heartbeat or breathing has stopped. It combines chest compressions and rescue breaths to keep oxygen flowing to the brain and other vital organs until medical help arrives. In essence, first aid and CPR are not just sets of skills, they are lifelines that can drastically alter the outcome of an emergency. They are tools that can buy valuable time, that crucial window that can mean the difference between survival and the unthinkable. Now let's take a moment to dispel a common misconception. First aid and CPR are not just for healthcare professionals. Anyone can learn these skills, and everyone should. Whether you're a teacher, a construction worker, a stay-at-home parent, or a teenager, knowing first aid and CPR can empower you to act in emergencies. It's not about replacing professional medical help, but about providing immediate assistance that could potentially save a life. Think about it. We are all part of communities, and in those communities, emergencies can occur at any moment. And in those moments, having the knowledge and the confidence to act could make all the difference. The knowledge of first aid and CPR can turn an ordinary person into a potential lifesaver. And wouldn't you want to be that potential lifesaver? First aid is the immediate care given to a person who has been injured or suddenly becomes ill. It's a skill that's as simple as it is crucial, and it can be the difference between life and death in an emergency. But what does first aid really mean? Well, first aid has three primary goals. The first is to preserve life. This is the most essential part of first aid, and it's about ensuring that the person stays alive until they can receive medical treatment. In severe cases, this might mean performing resuscitation or controlling severe bleeding. The second goal is to prevent further harm. This involves moving the person out of a dangerous situation if it's safe to do so, or making them comfortable to avoid exacerbating any injuries. It's all about minimizing the potential for further injury or illness until medical professionals can take over. The third goal is to promote recovery. This can be as simple as cleaning and dressing a wound or applying a bandage. It's about initiating the healing process as soon as possible to improve the person's chances of a swift and full recovery. Now, let's go through the 4 steps of first aid. The first step is ensuring safety. This means checking for any potential dangers to yourself, the injured person, and any bystanders before you start administering first aid. The second step is to call for help. This usually means dialing your country's emergency number. But it could also mean alerting a nearby medical professional, or even just shouting for help from passers-by. Thirdly, you need to care for the person. Depending on the situation, this could involve anything from performing CPR to simply reassuring them and keeping them calm. Lastly, it's important to stay with the person until professional help arrives. This can help to reassure them and allows you to monitor their condition and provide further care if needed. First aid doesn't require you to be a medical professional. It's about doing the best you can until help arrives. Remember, your actions can make a world of difference in an emergency situation. Cardiopulmonary resuscitation, or CPR, is a life-saving technique useful in many emergencies, including a heart attack or near drowning. It's a skill that can turn an ordinary person into a potential lifesaver, and it's easier than you might think. Let's break down the basics. First off, it's crucial to check the scene and the person. Safety is paramount. Ensure the area is safe for both you and the person in need. Look for any potential hazards that could pose a threat. Once the scene is deemed safe, check the person. Are they responsive? Do they seem to be breathing? If not, it's time to spring into action. The second step is to call for help. If you're alone, call your local emergency number before starting CPR. If there are others around, instruct someone to make the call while you begin the process. Remember, every second counts when it comes to saving a life, so efficiency is key. Next, we come to the core of CPR, chest compressions. Position yourself next to the person's chest. With the heel of one hand on the center of the chest and the other hand on top, push hard and fast. Aim for a rate of 100 to 120 compressions per minute. That's about the same tempo as the song "Stayin' Alive" by the Bee Gees. These compressions help to keep blood flowing and maintain vital organ function. After 30 compressions, it's time to give rescue breaths. Tilt the person's head back slightly, lift the chin, and check for breathing. If they're not breathing or only gasping, give 2 rescue breaths. Pinch the person's nose shut and make a complete seal over their mouth with yours. Blow in until you see the chest rise, then let it fall. Repeat this once more before returning to chest compressions. The final step is to continue these cycles of compressions and breaths until help arrives, or the person starts to show signs of life, like breathing. It's a physically demanding process, but don't give up. Your actions can make the difference between life and death. Each step in the CPR process is vital and contributes to its overall effectiveness. By checking the scene and the person, you ensure your safety and identify the need for CPR. Calling for help ensures professional medical assistance is on its way. The chest compressions and rescue breaths keep the person's blood circulating, delivering oxygen to the brain and other organs. And continuing until help arrives gives the person the best chance of survival. CPR is a powerful tool in your first aid arsenal. It's not about perfection, it's about action. So remember these steps, and you'll be ready to step in when life calls for a hero. Knowing first aid and CPR is more than just a set of skills. It's a mindset that prepares you to respond confidently in an emergency. Let's take a moment to review the vital points we've discussed today about the importance of first aid and CPR. These skills aren't just practical tools in your arsenal. They're an embodiment of your readiness to step up when the situation demands it. First aid equips you with the knowledge to assess a situation and provide immediate care to those in need. From minor injuries like cuts and bruises to more severe conditions like burns and fractures, knowing what to do can prevent further harm and even speed up recovery. CPR, on the other hand, is a life-saving procedure that can be used in emergencies such as heart attacks or near drownings, where someone's breathing or heartbeat has stopped. It's a skill that effectively buys time until medical professionals arrive, potentially making the difference between life and death. But the power of knowing first aid and CPR extends far beyond the individual. Imagine a community where everyone is a potential first responder, a place where everyone is prepared to act, not out of fear, but out of knowledge and confidence. These skills don't just empower individuals, they build community resilience. When more people know how to respond in emergencies, the community becomes stronger. It's not just about saving lives, it's about creating a sense of shared responsibility and mutual care. Learning first aid and CPR is like learning a new language. It's a language of care, of readiness, of responsibility. It's a language that speaks volumes about who we are as individuals and as a community. So, as we wrap up this discussion, remember this. In the face of an emergency, you are the first line of defense. With first aid and CPR knowledge, you are equipped to make a difference. You have the power to change and even save lives. This is the power of knowing first aid and CPR. In the face of an emergency, you are the first line of defense. With first aid and CPR knowledge, you are equipped to make a difference.